Medical technologists, also known as clinical laboratory technologists, perform and analyze the results of complex scientific tests on blood and bodily fluids. MedTech is in charge of preparing and analyzing those results. These highly skilled professionals mostly work in hospitals and independent laboratories. Duties include collecting, testing, and recording samples. The history of medical art. The ancient Greek concepts of health and illness were based on a theory postulating four humorous or basic elements of the body: blood, phlegm, yellow bile, and black bile. In health, these were in a stable equilibrium. Illness occurred when one or more of these humors increased or decreased and thus changed their proportional relation. This change caused an instability of the equilibrium state synonymous with health, and the breakdown produced illness. Nature, the force that inclined the humors toward remaining in or returning to the proportional relations of the healthful state, was viewed as the most powerful agent of healing. The purpose of the medical art was to assist nature to re-establish the proportional relationship of health among the humors.
My name is Jody Simmons. I'm a medical laboratory technologist, and we're at the Dawson Creek and District Hospital lab. Medical laboratory technologist works in the lab. They run patient samples, blood and body fluids. They're tests that are ordered by a doctor, and we run them on instruments, and we make sure that those results are accurate and precise before we release them to the doctors. A typical day would involve coming in and waking up all our instruments, and then we would have to pull quality control material to make sure that our instruments are running correctly. We would be doing any maintenance, like pulling apart the instrument and cleaning it before we would want to run any patient samples.
What is this machine?
We're looking at the inside of a chemistry analyzer. So when someone, for example, comes in the hospital with a heart attack or a suspected heart attack, this is actually one of the instruments we use to see if there's been damage.
Chong Hospital takes the lead as one of the most advanced medical facilities in the country since its humble beginnings in 1909, when it was established by the Association Benevolent de Cebu Incorporated by civic-minded Filipino Chinese leaders and businessmen. As Chong Hospital stated, since their founding in 1909, they have pioneered medical services of the highest quality in the Visayas and Mindanao. They have earned a reputation as an industry leader. It is attributed to the visionary zeal and foresight of their founding members and the Board of Trustees of the Association Benevolent Cebu Incorporated, as well as the support of the Cebu Chinese community. They also credit, foremost among other, the sheer hard work of its management and healthcare staff. These are the following services that the Chong Hospital offers: ambulance and emergency services, Center for Sleep Disorder, Critical Care Unit, Delivery Room Complex and Nursery, Endoscopy Unit, Executive Check-up Unit, Eye Institute, Heart Institute, Hematology Oncology, Imaging Services, Laboratory, Neurophysiology, Nuclear Medicine, Operating Room Complex, Outpatient Services, Rehabilitation Medicine, and Renal Care Unit. This is Chong Hospital Heart Institute's organizational chart. One of Chong Hospital's general rules are strictly no smoking within the hospital premises as per Republic Act 9211. Alcoholic beverages are not allowed. Firearms should be deposited to the security officer, and additional furniture, electronic, electrical, and medical equipment brought from outside are not allowed. These are the following rules and services offered by the Chong Hospital. For housekeeping, you are discouraged to bring pillows and linens for infection control purposes. Hospital staff collects all empty food trays inside the room, so please do not leave them outside. For security, you are encouraged to leave all your valuables at home. Please keep your room locked, especially at nighttime. The hospital cannot be held liable for anything lost during your stay. For other charges, all incoming calls are free of charge, while outgoing calls shall be charged accordingly. Ambulance services may be provided for a corresponding fee. For parking, for your inconvenience, the hospital offers valet parking services at 15 pesos per hour, 24 hours, 7 days a week. Basement parking is strictly prohibited. For patient identifier, for patient safety, we use double identifiers, in example, name and date of birth, to ensure the correct patient receives the correct medication and or correct procedure. You will be repeatedly asked to provide the information in the course of your confinement. Please bear with us and do not remove your identification band.